Dr. Fu, and thank you to everyone for coming. So this is our first time to see the class officially, but I'd like to welcome you. And I see that 10 of you over there. Can you hear me? Class, just raise your hand. Can you hear me? Good. All right, I'm very proud of you. Many of you do very good presentations. And I'm surprised nobody did headache. So that's okay. So we focus our shift today on skin. In the next 1 hour or 1 hour and a half, we like to do patient-doctor interactions. And I hope you will get a lot of information from Dr. Ho already. In skin problem, believe it or not, 99% still from the histories. Like any type of medicine, history, and histories. They will tell you what happened, and they will tell you what is the diagnosis. I'd like you to get out of this lecture just a couple key points. First of all, I'd like you to know what is acne, because this is not just for your patient, but for yourself. From my experience, many Vietnamese medical students having acne. If you are a doctor and you're not able to take care of your acne, patient won't trust you, right? How many of you have acne? Or okay, don't answer. You don't have to tell me whether you have acne or not. How many of you see your friend have acne? Just raise your hands. All right, so you saw somebody around you having acne. Well, all of you, okay. So that said that many of you see acne. Whenever I give talk to medical students, I like to make sure that they know how to treat acne, because this is so simple. This is very basics, and any doctor can treat acne. All right. The second thing, I like you to make sure that you can apply the old code for the past 2 weeks into this module. Make sure that you ask, again, the history, location, onset, duration, because for this entire course, we go back and forth, try to make sure that we go from the beginning to the end with the same template, like Dr. Dinh Văn or Dr. Fu already taught you. All right, questions? And I like interaction. I like you guys raise your hand and tell me any question. Go ahead. I like to hear some comments. Any questions so far? All right, no questions? All right, so let's do this. Why don't we pair as a team, and who would be my first patient and who would be my first doctor?
Hello, Win. The class, we have 3 teams, A, B, and C. Mm-hmm. And each team, we have a team leader. So maybe you just ask the team leader to control everything. So the team leaders are 3 doctors there. Okay, Dr. Phú Trọng, Trọng Phú, Dr. Thi, and Dr. Vân. Okay, yeah.
All right, thank you. So may I ask each team leader designate one person, one victim? Okay. Go ahead. Come on, guys. If you want to listen to lecture, there's a lot of opportunity, but this is your time to do real interactions. This is how we like to see you talk, and this is how we like to give you feedback, right? So think about, do it right now. Come on, guys. All right, let's see who is, okay, good. Finally, somebody. Well, I promise that I won't tell, just don't tell if you're a patient, don't tell your doctor that you have acne, okay? So people can laugh at you. That's okay. Very good.
Okay, you just turn on the microphone. Yeah, good.
Hello, can you hear me?
Yes, excellent. Very good.
Okay.
All right, who would be my patient and who would be my doctor?
I'll be my patient. And I'll be the doctor.
Okay. Well, Dr. Dinh Văn, would you mind just turn on the mic, turn off microphone for the other group so we don't have any echo? And I will turn off myself. All right, guys. Now, what topic you would like to I'll like make it easy. Okay, so what condition you would like to tell your doctor? You present psoriasis, right? No, actually, zoster. Which one you present? You present zoster? Okay, why don't you tell your doctor about your psoriasis? Okay.
Yeah, actually, I don't prepare about psoriasis.
Okay, so why don't you, yes, and then so if you, I'd like to make sure that, so if you already been, that's why don't you start with the zoster, okay, the one that you presented.
Okay, as far as I know that everybody have assigned to one case. So maybe they have prepared one case. I'm not sure that if you fall down to the psoriasis or no, so I'm not sure.
Ngọc Anh, you prepared the zoster, right? If I remember. Yes. Why don't you go ahead? Okay.
Yeah. Hello. My name is Naman, and I'm a 6th-year medical student with Dr. Win. May I ask your name, please?
My name is
Okay. And how are you?
I'm 45 years old.
Yes, 45 years old. And I will ask you some information to make it clear about your situation. Is that okay?
Okay.
Yeah. So, what brought you into the clinic today?
Yeah, actually, I feel really painful about in my left chest.
Painful on your left chest?
Yes.
Yes. So, could you tell me more about it? Where exactly the pain?
Yeah, it's just here.
Okay, I see
right
that.
backward.
It's a start from the left chest and then it spread to your back.
Yeah.
Yes. Okay. And how long have you been the chest?
It's about 2 days ago.
2 days ago. Okay. And was the onset acute or is start gradual?
Yeah, I think that it's appear really suddenly. Like I just see that area a bit red and swelling and it's really itching. Then I felt painful.
Yeah, I see. And okay, has it changed over time? Has the
Yes, like I already told you that at first it's just like itching and like the burning, feeling burning.
Okay.
And then it's really painful.
Yes. Are there any other obvious trigger before it?
I don't think so.
Okay. And is there anything else associated with the symptom or with the pain?
Yeah, I see some vesicle on that area.
Vesicle. Okay. So does anything make it worse?
Yeah, just like I do in my housework or I just walking is still I mean it's pain all the time and
Okay.
this will increase when I do some exercise or some activity.
Yes, I see that. And how would you rate for the pain on a scale from 0 to 10? 0 is no pain and 10 is very painful.
Yeah, about a few days ago, I think it's just 2 or 3. But yesterday until now is about 8.
Okay, so the pain is rise. Okay, I see. And have you taken any medication to relieve the pain?
Yeah, I take some paracetamol.
Paracetamol. Yes.
But it didn't help.
And it doesn't help.
Yeah.
Okay. Have you had anything like that before?
Yeah, actually, is I mean, this condition didn't happen before, but when I was 6, I have a chicken pox.
Okay, chicken pox when you were 6.
Yeah.
And how was it? What the medication or what the treatment did you use to treat your chicken
Actually,
pox?
I don't remember about that.
Okay. Yes. And was it the same or different with the current chicken pox? Was it the same or different than the current situation now?
Yeah, I think that it's not really painful like now. Yeah.
And I will ask you about some history, medical past, the past history problem.
Yeah.
Yeah. Do you have any medical treatment?
No.
Yes. Okay. How about your skin? How does it react to the sun exposure when you go out?
Actually, I have acne when I was about the age of teenager, but I think that it's disappeared now.
Okay, I got it. And how about your family member? Are there anyone else in your house that have a similar to you?
No.
No. Okay. Do you allergic to anything such as dog or pets?
Yeah, I think that I allergic to pet fur.
Pet fur.
Yeah.
Okay.
That's why I cannot have a dog, but I really want to.
Okay, no dog. Yes, I see. So, after asking you a few questions, I will give a short summary about your complaint now. Yes, you are 55 years old, and the chief complaint is painful. It's pain on your left chest.
Yeah.
Yes, it's appeared about 2 days ago, and then it's spread into your back. Yes, and the pain is 10 out of 9 on your scalp, and you have used some paracetamol to relieve, but it doesn't work. And beside the pain, you are having some rashes, vesicle, and swelling, and itching.
Yeah.
Yes, and in the history, you was having the chicken pox and some acne when you were a teenager, and you are allergic to the cat fur. Yes, is that right to you?
So, what is your diagnosis to my condition?
Okay, I think based on the finding I asked, I think you are having the varicella zoster. Yes, because of the typical findings. Yes, and I will tell to my teacher and give you some treatment later. Okay, thank you for the help today.
Thank you, guys. Excellent, very good job. So let's get some feedback. And class, actually, I like your feedback first. I like you to pay attention on your classmate because this is also important. Some of you doing good job on feedback, we will compliment on that. So make sure that you focus on what your classmate doing and think what did they do not do well and what they have done well. So class, tell me, what did they do well? Come on.
Miss Thing from Timay, and I have some ideas about the cases.
Yes.
After we are taking the history of the patient in skin problems, we should have some physical examination and try to listen. Yeah, I think it's better for the diagnosis.
Excellent point.
Yeah.
What else?
And
okay, I give you guys here before I received feedback from Dr. Hall and other instructor here. Come on, guy, you are a medical student, you're gonna be doctors. A guy, 46 years old, present to you at the chest pain. Before thinking about skin problem, your first job is to make sure this guy does not have a heart attack. Okay, the number one job is for you to save a patient before you treat the skin problems. I mean, if he die, yes, you can take a look at his chest later, but your number one job if someone presents chest pain. Okay, so just want to make sure that you take priority if people tell you what is a complaint. Yes, this is a classic K exhauster, but if they're telling you this is chest pain, you're gonna make sure that history of smoking, any history of current risk factor, diabetes, high blood pressure. Okay, so just make sure, because that's so important. Again, your number one job is to save somebody's life before you check their skin. All right, any other comment from the class before I let our instructor feedback? All right, let's go around. And Dr. Fu?
Sorry, I think probably feedback with, I'm sorry, just a little bit, it might be so rude, but I think we might say a little shorter feedback, and like we typing along so they can have, time to look at it, and we're saving, otherwise the other, student will sit there and listen to us more than what they talk. So I think that the case is probably something, I've typed it, I'm not sure why you see 10 out of 9 scale, a bit that's not 10 out of 9. So, and I think if not, I'm not mistaken, she said C 45, but now you said C 55. So be careful when all these things are important. But you're still having trouble with saying allergic words. So just you have to repeat again to make sure that word. I think sometimes you have a bit hesitant when you say that word. And lastly, when you're talking to patient, you don't use the technical term, varicose exhauster. Of course, I understand, but a lot of people don't understand. Using, just one common term, don't use any jargon term, and using just simple term to the patient all along, not just jump in and out using different term. Okay, thank you.
Thank you. All right, so
when the patient gives you, last lecture I told you, when the patient gives you a positive lead, you have to follow it. Just don't ignore it. Huh?
Thank you. Go ahead, Andy.
Class, I would like to tell you, when you make the interview, make it shorter. Okay, I count it's more than 50 minutes. You don't need 50 minutes to take an interview in this case, number one. Number two, this one is about shingles. So by your history and your interview, I couldn't catch anything related too much there, okay? So you very good to follow the old cards. That's correct one. But you have to concentrate on what is the problem with the patient. And now the last one, that because we have 15 people, we have to make it short and everybody have to talk. So we just only which one is very important, we will give you the feedback right away. Otherwise, we leave at the end of the session, so we can talk in general which one that we will have to learn from. Okay, that's it. Thanks.
All right, so why don't we move on to the next one? But I'd like to give you a 30-second feedback here. You try to avoid terminology like Dr. Ho, but I like to make sure that when you ask triggers, you describe vesicle, and then when you ask somebody about a history of 6 years old, she mentioned that she had chickenpox when she was 6 years old. It's very hard for her to remember how were the symptom at that time, or his symptom. In this case, it's a male, and he's 46. And one last thing, when you examine a skin problem with a female in the US, I usually have a female chaperone with me, because you are going to examine some of the very sensitive areas. So before you tell them, you will say, this is a male one, so you probably will not, but you will ask, I'm going to examine your skin, and I hope that's okay with you. So you let the patient know that you're going to examine them. And I know in this case, you guys play a role, but at least you should tell the patient that I'm going to examine your skin, and after that, this is the findings. And yes, so that's pretty much for this case. And let's go ahead to the next one. I like the idea that we give in feedback by texting Dr. Fu. I think that will be faster. Okay, who is the next two ones?
I like the team leader to assign your team to be ready for next one. They please no downtime.
Yep.
I think you guys are very, very slow today. Should be quicker.
Oh, so they use it very fast, and then so they just like this, pick a case and go. Okay. All right, go ahead, guys. Speak louder and clear. Yes.
Okay, will be a doctor.
Okay.
Good morning, Miss. I'm Tuấn. I'm 5th year medical student from Untitled University. So I want to ask you some questions about your case. Is this okay?
Yeah.
Thank you. So could you tell me what brought you here today?
I have spread in my chest, in my belly, and in my lungs.
Oh, when did it start?
2 hours ago.
So what do you remember? What were you doing when it started?
After a bee sting to my arms, the skin in my arms started to swollen, and then it spread into my chest and my belly.
So it starts suddenly or gradually?
It started after 5 minutes after the bee stung to me.
Could you describe your lesion more detail?
It's a lot of pruritic, swollen. I feel it's hot when I touch into the skin.
So how about another side?
Anything is okay, just swollen and pruritic.
So, any fever or pain?
Just pain in where the key stuck to me. In another way, it's not pain.
Do you anything that makes you better?
My mother gave me some ice to put into the skin where the key stuck. It's better.
So, anything makes it worse?
No.
On the pain scale from 0 to 10, if 0 is no pain and 10 is very pain, so how much is your score?
In the start is 6 over 10, but now it's 7 over 10.
So this is the first time you get it?
Yeah, it's the first time.
Do you have any sickness before?
Sickness. I have some normal sick like flu or something we want to add.
So,
Excuse me, could the patient describe the skin lesion to the doctor? Could you tell the doctor how you feel? How does it look?
I feel pain, red, pruritic, and swollen in on my body. I feel hot in the skin, and I so worry about it. It's so pruritic.
so you have a history of allergic with something?
No.
Any member in your family have
My mother was allergic with penicillin.
So I want to see this vision. Could you please allow me to see that?
Yeah.
Thank you.
Hey guys, that's a shorter version. I think that's okay. So let's get some feedback and let's see what the class, any suggestion or feedback from the class first. And guys, for your class, I'd like to make sure, think about if you were in this situation, what would you do better? I'm sure when you see your classmate come up there and ask your question, you will ask yourself, should I ask this question or should I do something else? In real life, you won't have that many minutes. In real life, when you see a skin problem, you have about 5 minutes or less. That's a typical situation. So 50 minutes, it's way too many minutes. Okay, anything else?
Thái Châu, stay Thái Châu. Why don't we reverse the role? Thái Châu, just reverse the roles. 5 minutes. Is that okay, Win? To see whether they can see. Tuấn, stay where you are, Tuấn.
No, please. Okay, just follow and follow instruction. Thái Châu and Tuấn, you reverse the role, okay?
5 minutes, no more.
Let's try it.
Hello, doctor.
Can I have your name?
I'm Tuấn.
How old are you?
I'm 55.
So, what's your problem today?
Yes, I I feel a rash in my right foot.
A rash in your right foot.
Yes.
Where does it happen?
It happened yesterday. Yesterday.
What did you do in this time?
I don't remember, but I always wear shoes.
Wear shoes.
Yeah.
Can you describe your rash?
So it's so itchy. It's red.
Yeah.
Itchy. It happened.
Can I see this rash?
Okay.
Okay. Now, do you feel it's bruising?
What?
Do you feel it's swollen or bruising?
It's swollen.
Yes. Did you have the same rash before?
No, this is the first time I had it.
This is the first time. Do you have anything to make it better or worse?
So I have to scratch it a lot, so I feel better. Nothing much worse.
Can I ask about your family?
So what information do you want?
And other members in your family have the same problems like you?
I remember maybe no one in my family had it.
Okay, let me summarize your case. You are 53 years old and you have a rash in your right leg. This is the first time you have it and it's red and swollen. Your family don't have the same problem with you. When you rash it, it's become better and nothing make it worse. Okay, this is enough for me. Do you have any question for me?
I think it's enough.
Thank you so much.
All right. So what is the diagnosis? Okay. So let me give you a hint. Unilateral itchy for a 65 years old male, just by guess wildly, likely itchy problem is likely a fungal. It could be something else. It could be, but you are giving a patient some hint right now. Let me turn up here. But I like the way that you ask those, but try to avoid pruritics, or you use itchy, because itchy is very common term, people know it's itchy. And then when you rash, and you can say, oh, have you tried anything? Because there's a lot of over-counter antifungal for food problems, and they could have tried that. And if they answered yes, and if it helped, it likely confirm your diagnosis. All right, so feedback from other instructor or the class too. And like Dr. Hall say, I like you guys, when you see a patient, you can ask, what brings you here today? Or what can I do for you? Don't ever ask, what is your problem? This is the number one thing people will hate you. If you really want to let people hate you, I'll tell you, this is the first time. If you keep using that, nobody will like you. This is very unprofessional. So try not to do that. We learn about speaking. We learn about how to communicate with patients. Make sure you can just look into their eye. What can I do for you today? Or what brings you here? Okay, simple. And they will tell you exactly what's going on. All right, next, go ahead.
Okay, I have some comments for the parent.
Yes.
When the patients came to you because of a bee sting, I think you should ask more about what kind of bee is it. like we should describe more detailedly about that bee, and maybe it can produce some kind of poison. And the second thing we should notice when the patient have a bee sting is that we should look for the signs of shock on the patient. We should ask if the patient feel breathlessness or breathing. I think that's what we should notice.
Those are very good point, because what are you concerning?
I'm afraid maybe the patient can have some kind of allergic shock. What is
the term for that?
Wait a minute.
Okay, class, what it's called? You should know that term.
Anaphylactic shock.
Anaphylactic reactions. Okay.
Yes.
So that's what you're looking for.
Yes.
All right. Now, why don't with the next couple student we do reverse role? Okay, I like it. You do 5 minutes first, and then the last 5 minutes we do doctor and patient, and vice versa. I like the two of you, and at the end you try to give the patient or the doctor your diagnosis. I'll focus a lot still on history. I'd like you to talk to your patient, try to get as much as possible in 5 minutes. Okay? Anything else, guys? Yes, Anho.
Turn on your mic. Turn on your mic and food.
Let's move on. Good. Yeah.
All right, guys, come on, moving faster.
You should do quickly, otherwise you lose your job. If you work like that in here, you lose your job right away in the first day, okay?
Okay, come on. Let's do energy. Okay, look at your patient, smile, speak loudly, confident. Okay, come on, guys.
I'm the fifth year medical student. Nice to meet you. Can you could you give your name, please?
My name is
Can I take notes from let me right? And may I guess your date of birth?
Yeah, I was born in 2000. Yeah, I'm 18 years old.
And what do you do for a living?
Yeah, I'm just a student.
Okay, so tell us what did you get today?
Yeah, I feel some itchy in my ankle and my knee. Yeah, and sometimes in my back too.
And when is Easter?
Yeah, it's about some years ago, but now it will get more and more, and I feel annoying now, and I'm come to your clinic.
Were the onset appear gradual?
Yeah, I don't remember detailing, but I think it's when it just start in the ankle area. Yeah, and after that it held in my knee, and yeah, especially in the extender. Yeah.
and about your class.
Yeah, and until now I see some area in my back. It have the same symptom.
Pain problem train all the time.
Yeah, it just get bigger and bigger.
Can you write it for me?
Yeah, it's red, and it just gather together, and it have a scale.
Can you give me the number of lesions you have?
Yeah, just 2 elbow, 2 knees, and some areas in the back.
Are there any other treatment for the symptoms?
Yeah, especially when I feel tired, and or some more stress in my life. Yeah.
Okay, tell me more about what makes it better.
Yeah. I go to the pharmacy and ask for some drug, and they give me some kind that I think is steroid. Yeah, and it makes it better when I apply on my lesion.
Over the culture?
I don't know. Yeah.
And what's the last word?
Yeah. Get worse. Yeah, I think when it's held better. Sometimes it's and sometimes it disappears, and especially when I feel tired, yeah, I feel tired inside. Yeah, it makes it worse.
When you take steroid, it doesn't work.
Yeah, it's better.
Are there any other symptoms that we associated?
Yeah. Sometimes I get fever, but it's not last. It's just on and off.
Have you experienced this problem before?
Yeah, I told you that I have this 2 years ago. Yeah, 2 years ago.
So now I want to discuss about your past medical history. Hey, anyone in your family has a kidney problem?
Yeah, I have my father. Yeah, my father had a SAM.
And did he take medical condition?
Yeah, I don't remember, but he just applied something like me before, and it has.
Have you had any allergy?
Yeah, I allergic to something special. The cat. Yeah.
Cat?
And shrimp. Shrimp. Yeah. Yeah.
Okay, about your social history, do you use tobacco?
Yeah.
How much?
Just one cigarette per week. I don't dare to smoke more.
And how long?
Sometimes. Yeah.
And do you drink alcohol?
A little.
About recreational drugs, do you?
No, I haven't.
Do you usually exercise?
No, I don't. I don't go to. I don't do exercise so much.
Okay,
Yeah.
so now I will talk to you what that information I get from you, and please correct with me if I listen to you.
Okay.
Your name, your name 18, and you are 18 years old, you are a student, and the problem you will explain is about your team. As you have problem you feel itchy and pain in your elbow, your knee, and your back. And you had this few years ago, maybe 2 years ago, yeah. And it's bigger, and you see it's red, and now it's cold. Yeah, cold. And when you're tired, it's less work. But you use steroid for it, and it's better. And you also have fever.
Okay, guys, I think time's up. Why don't we reverse the role? You did more than 5 minutes already. So let's try to do 5 minutes this time, okay? Now you become a patient and the doctor become patient and vice versa.
Hello, nice to meet you. Yeah. My name is Tim. I'm the 6th-year student with the school. Yeah. And could I have your name, please?
My name is Thảo.
Yeah. And what is your age?
I'm 15 years.
15 years. Yeah. So what brings you here today?
Oh, I have problem with my chin.
Yeah.
Yeah, with my knee here.
Yeah. And how long has the lesion been recent?
It's maybe a week ago.
A week? Yeah. And how did it look when it started?
I don't remember, but I feel a rash in my knee.
Yeah.
It makes me feel itchy and painful.
Yeah. And could you tell me some more detail about your lesion on your knee?
I don't remember, but it's red.
Yeah, red.
Yeah. Maybe it's like maybe 5 centimeters. 5 centimeters.
Yeah. And is it different from now?
Yeah. It's warm. It's bigger.
Yeah. Except the knee, is there anywhere could you help?
Yeah.
Yeah. And have you ever treated? Have you ever had treatment before?
No, I just need those today.
Yeah. How about associated symptoms? You have fever? You have.
No, I just feel itchy and painful.
Yeah. Is it the first time?
Yeah, the first time.
How about your family? Is there anybody have the same situation like you?
No.
And how do you think about your lesion? What do you think about the course?
I think it's
Burning. Yeah.
Hot.
And ask you, what cause of the lesion do you think? What make it? You think this thing?
I don't know.
Yeah.
I just see here.
Yeah. Is there any changing in your life recently?
Yeah, I get a new job.
Your job? What kind of job?
Worker in a company.
Yeah. How about the bus?
I don't know anything about that.
Yeah, just what do you do? What did you do before? What did you do before? Do you recognize something special on your new work, in your new work life?
Yeah, I think the environment not good.
Not good?
Yeah.
Can you tell me more detail?
I work in the industry of listening and not about pollution. And the toxic, I don't know really.
Do you smoke?
Yeah, I bought
How much?
a batch a day.
Yeah. About the alcohol?
No,
Are you allergic to anything?
yes, I actually receive food. Thankfully, to October.
Octopus? Yeah.
All right, guys, I think time's up again. And so what do you think? What is the diagnosis?
Yeah, and I think the patient had itchy and rash in the knee, and she had allergic to something. And in my head now, I think she has a psoriasis.
Oh, itchy, rash, and knees, and I mean a lot of things can cause the problem. Okay, and but it's okay. I mean for this type of class, but for the entire class, think about it. It could be something else. It's not just psoriasis. The way that you describe it could be atopic dermatitis. It could be something else too. But let's keep for the purpose of this course. Let me give you some quick feedback, and I said already, you guys. Let me turn this one off. A lot of time it sounds like when you ask a couple of questions and then you lose your focus, you lose your positive lead, and then you look up and you go around. This takes time. Okay, don't worry, it will get time. Especially when you go higher and higher in your training, you realize that, oh, this is number one focus. Just like, okay, where's my money? Go back there. And why they here, and all your questions. So don't just, okay, it will take time, and I can see that. Some of you already go that route. And that's why we're here today. That's why we like to remind you again, okay, where is my positive lead? What is the number one concern? Because it's very easy to distract. Okay, and make sure that you look all the comments, because now we try to fit comments on the screen. And a lot of time, again, try to avoid technical terms. And I think you guys did a better job. You try to avoid that. I like it. All right, we're gonna take a 5-minute break after this. And I think we have, so far we have 6 people, right? We have 9 more people, right, from the class, right? And then, okay. All right, so let's move forward. Each of you have only 5 minutes to play a role as a patient, and then only 5 minutes as a doctor, okay? And then we come back in 5 minutes. It is 7:05 p.m. my time right now. We will resume at 7:10, okay?
Hello, class. Okay. Are you ready? You prepare for two people to play the role as the doctor and the patient. And this time, we will ask somebody else to make a summary. Okay. So you should listen very carefully about the medical history, and then somebody else. It's not of the two people in the interview, but the other one will make the summary for us. Okay.
Come on, guys. Let's move it quicker.
Oh, please turn on your mic. Turn on your microphone. Good.
Hi, good morning. Nice to meet you. You are Mr. Trung? Yes. And you're 23 years old? Yes. What brought you to hospital? Sorry. My name is Ngân. I'm a fifth year student of Concord University of Medicine and Pharmacy. Today I'm going to help you. What brought you to hospital today? I got a black on my leg. It's very itchy. Both of your legs or? No, it's just on my right leg. Your right leg? Yeah. Is it scattered or it's localized? It's localized. When did it start? It began 1 week ago. And how is it when it first appeared? At the beginning, it began as a red flat area on my leg, but lately it raised. It have a raised border, and it become and filled with scale and vesicle. Is it spreading? No, it's just localized. Can you describe the exactly location of the? This is on my right leg. This is round shape. The colors is red, and there are vesicle and scale on the lesion, but it's but it distribute more on the machine. Do you think anything could trigger the lesion? No, I don't know, but I often wear tight skin, tight string. Does anything make the lesion better? No, I didn't take any medication. Does anything make the lesion worse? I noticed that when I'm sweating, it's very itchy. It's very itchy. Do you have any other symptoms? No. Do you contact skin to skin or use share towel or clothing to other people? I share a room with my friends and she used to have similar symptoms like me. At the same time, or for in the past or for the last couple of months, do you have any fever or? No, I don't have any fever. Okay, I will summarize. I will summarize your case. You are have a plaque on your right leg, and it is red, and it is scaly, filled with vesicle. It started from the last week, and you feel it is very itchy. It is worsened when you sweaty, when you have, and you didn't take any medication to relieve the lesion or itch. And based on this finding, I think it is fungal infectious disease, because it is on the location that sweat, and you contact skin to skin. You share rooms with your friend, and she has a similar symptoms. And I think your description is typical of fungal infectious disease, because it's a ringworm, right? And can do I have to give the treatment?
Well, you don't have to. This is focused on history, but you can get 1 or 2 lines. That's okay. And I think you get time is up too, so it's okay. Let's reverse the role now. Now you become a patient, and I think that's her name is Phương Trúc. You're gonna be the doctor, okay? Yeah. So go ahead, guys.
Please have a seat. Can I have your name, please? My name is and how old are you? I'm 23. So, what brought you in today? Sorry. My name is Trúc. I'm a first-year student of the University of Medicine and Pharmacy. So today, what brought you in today? Oh, I have many blisters on my chest. Blister on the chest. When did it begin? For 2 days ago. At that time, what were you doing at that time? Oh, it's sudden. Does it localize or spread on your chest? At the first time, it appeared on my left side, but it rapidly spread on my chest. Can you describe more about your blister? At the first day, it began with a bump, chest bump, but after that, it is rapidly turned to blister. Is there any associated symptom? I feel very itchy and tingling before the rash. Before you have blister? Yes, and it's the same reason. before as the lesion. Did you do anything to release your distance? No. Is there anything make it worse? No. Do you have fever? A week ago, I feel fever, but I didn't take the temperature, and I have sore throat. Yeah, at the same time. Yeah. Do you take any medication now? Is it the first time you experience the symptom? Yes. This is the first time. So, in the past, did you take any vaccination? I didn't remember. I don't remember. Do you have allergies? No. Do you smoke tobacco? Drink alcohol? Do you have any disease about lung or heart? Lung. Lung. Skin disease? No. So you just have blister? Yeah, just blister. No fever? Fever a week ago or so. I can't hear your voice.
Oh, okay, sorry. Time's up again. You don't have to write down the notes and try to see if you can do a quick abbreviation. So you can say plus or minus this and this instead of keep writing. Sometimes it will take you longer. I don't know if you try to use a system that you just plus or minus and you quick you see KCS, and that will be a better way instead of keep write the whole thing. Have you tried that one yet? Try to do a system that only you understand. You do plus, minus, whatever sign, but let's do it quicker. And then if you do this, you lost your eye contact. And that's so important. If you look at a patient, they like you. If you don't look at them, even if you tap on the computer, you lost all of the trust. So don't do that. Try that. Okay. All right. Now I like to go back to class, and I like some of you give really good feedback. Okay. Think about your classmate and tell us what they did not do well. Okay, come on, class. Be proactive, faster. Just come up there and say, hey, doctor or teacher, I don't think he's doing well, this and this and this. Okay.
Vâng, call the name.
Go ahead.
Hello, Lars. I will give some feedbacks about the conversation between Ngân and Trúc. I think that in Trúc question, she should ask about family history of the patient, because after listening the conversation between Trúc and Ngân, I think that Ngân disease is zoster, and I think that Trúc should ask about chicken pox in the past. Yes, that's all.
Okay, thank you. I don't know if I told you guys about feedback, one of my preferred method called sandwich. And if you do it, people will or likely to listen to you better. The first one, you say what they do well. And the next one, you say, oh, those are things that you can improve. And last, you just reinforce that. So for example, the last case, you say, oh, I like the way that the first one keep eye contact. And then you say, however, there's room for improvement for the second case. I prefer the doctor keep better eye contact rather than just keep writings. And then you summarize, but overall, they show compassion when they talk to the patients. So just by single line, first one, how do they well, and the next one not well, and then you summarize that. Okay, anything else from Andin or Anfu before I move to the next one?
I think that we just move ahead with the other one, and then we just summarize in the general mistake that the people make.
Yeah. Okay, guys, faster. Come on. Go, go, go. 5 minutes for each. Shake hand, keep eye contact, introduce yourself. Again, make sure you know the patient age. If the patient tell you their age, remember that.
Hello, miss. My name is Paul. I'm a fifth year medical student working with Dr. Paul. Yeah. Can I have your name?
My name is Jane.
And how are you?
I'm 24 years old.
24. Okay. What do you have today?
I had this rash on my knee.
This one, your knee.
Yeah.
And when did it appear?
Last year.
Yes, word.
Yeah.
And can you tell me how actually this gets worse? Because you know it happened 1 year ago, right?
Yeah.
And how is it worse?
A few days ago, one year ago, I had some rash, but a few days I had multiple rash.
Multiple rash.
Yeah.
Increase in your mouth.
Yeah.
And can you point me its actual location? Is the front side or the back side?
The
left or right?
Attention.
Down there, yeah. And how do you feel?
I feel a little bit itchy and painful.
And it is burning.
No,
It is dry or wet.
it's dry.
Yeah. And is there any more lesion on your body except it?
Yeah.
Yeah. And 1 year ago until now, did you do anything to make it better? Treatment for treatment.
I had some cream put on my knee, but it doesn't work.
It doesn't work. Can I have this the name of your cream?
Oh, I'm sorry, I forgot.
Yeah, and something make it become worse. Water, your stress, or food, anything. Yeah, and when the lesions appear, there is some other symptom. Of course, you feel another something like.
No, I don't have a fever or chill or something like that.
Nothing.
No.
Right? Yeah. Oh, now I will ask you about your medical past history. your parent or your brother or sister any similar?
My parents still alive and they are healthy and well. I had one sister. She had asthma.
Your sister has asthma.
Yeah.
Yes. Can I ask you for some question or some more question? Your knee 1 year ago is contact with some strain agent or something something unfamiliar. Can you guess this?
I think it's a long time for me to remember that. But a few days ago, I was hiking with my friends.
Hiking?
Yeah.
What happened?
Maybe I touched another grass. I don't know this name.
Another grass? Where?
Yes. On the mountain, because I tell you I was hiking with my friends.
Yes, and you take grass?
Yeah.
Where?
On my knee.
Yes. Ooh. Okay. So thank you for your information.
Thanks, doctor.
Okay. All right.
Now
time's up. So I try to cut you again. Try to focus, and it will come with time. So, Twing, what is the diagnosis you try to tell him?
She had a rash on the knee for 1 year. I think it's look kind of like psoriasis. No, psoriasis.
Well, just FYI, psoriasis is more common for Caucasian compared to Asian, okay? And then the prevalence is way less compared to other common. I know some of you become, psoriasis expert after today, which is okay. But let's focus on basic, okay? And try to, it doesn't matter what problem they have, just go back to history. And sometimes if you don't know, you can tell. I'm not sure yet, but based on your symptom, we do a couple more tests. And let me examine your skin, and we'll tell you what could it be. Okay, you don't have to tell a lot of time. Many times you don't have to tell the patient what exactly. There's a lot of them are classical, so you just by look at that, and yes, it's psoriasis. But a lot of them are evolving. They scratch. They have excoriations. It's hard to know. Okay, so Thing, what you trying to tell him? What is your diagnosis? Allergies. Okay. So this is a good example of that you see that sometimes the symptom of both of them may look similar, right? Or itchy, and then present with this flag. Okay. Anything from the class? And now let's reroll the role between the two. And I give you 5 minutes. Let's rock and roll. Okay, come on, move faster. 5 minutes.
She is allergy. Yes, but she told me that it happened 1 year ago, right?
Uh-huh.
Now she's
good point. Yes. So you're gonna argue with her after the class to say, Dwayne, you give me the diagnosis and the symptoms are not consistent. Let's go to the library together and figure it out. Okay. So that's the why that's why you're here today. Okay. So that's a good point, because sometimes you like to make sure that your symptom, whatever you try to tell, should be consistent with the diagnosis. Okay, don't trick your classmate like, okay, you try to tell a different diagnosis. Okay, but that homework for you too. Okay, try to make sure that she will explain to you why she thinks this is the symptom, and you will tell her why you think her symptoms are not consistent. Okay, let's do the reverse roles. Now it's your turn.
Hi, doing. I can't hear you. You have to move your speaker closer. You speak too softly.
Come on, guys, speak loud.
Because I just use screen.
Screen.
Yeah.
Yes,
and maybe I get allergy last year, and a few days I get another allergy.
Oh no, I got it.
Yeah.
You mean that your allergy is not last for 1 year. It happened and disappeared, and now it's happened again, right? Okay.
So,
I made understand.
Okay, problem solved. Go ahead.
Hello, Mr. My name is Jane. I'm a PhD medical student with Dr. Quinn. Can I give your name, please?
My name is Howie.
How are you?
I guess it's 45.
So what's brought you here today?
As you can see that I have so much rash around my body, see in my face, in my chest, my belly, and even my back, and it feels so annoying.
When did it start?
Just 1 day ago. No, the evening, yesterday evening.
Do you have associated problem?
Associated problem there are a lot. I feel hot. Maybe I get a fever. My throat feels sore. My eye is burning, and I have my nose is running.
Could I see your lesion, please?
Oh, of course, doctor. over there.
Did you measure the temperature?
No, I didn't. But maybe so hot, so high. I feel so tired, and it's hot.
Is your associated symptom start before or after your rash?
After the rush is come first.
Do you have any allergies?
No, I haven't recognized anything before. But I think this time is the allergy. I forget.
Are there any obvious features for this?
No, because it happened in the evening, and I just at the beginning, it's just a few rash on my chest. So I think it's normal, and I not care about it so much. So through a night, it's become so more severe. So I came here, and with no treatment.
What makes it worse?
I didn't know because I sleep one night and come here.
How did you do to relieve this problem?
No, I cannot find anything to relieve this.
Do you take any medication or any treatment?
Not at all. But But now I have been using allopurinol for gold treatment, and for 1 week ago, my goal is gold. The collection of acid uric in my finger. And this is the first time I had it.
It's gout.
Gout.
Have you experienced this problem before?
No, never have.
Is there anything new or different in your life?
The new different in my life.
New or different change in your life?
The time duration is so short. So when it happened, I come to the hospital immediately. Yeah.
Has anyone in your family has a similar problem?
No one has the rash, the rash severe this month, but I know that my father has a first allergy, a cat first allergy, but not so much severe.
Have you had a pet?
No, my father has one, but we live apart.
Did you contact to certain substances?
Certain subject.
Substances.
Some strain.
Like chemical substances.
Yes, I know the substances, but a day I was exposed with so much substances, right? And which one do you want to know?
Excuse me, can I ask you, have you exposed to your occupation environment?
Occupation environment. I work in an office with just I just doing paperwork in a conditioned room. There's no touching, there's no so much dusty, but I guess I will not allergic with them.
Okay.
I worked for so long.
I think that's all I want to get from you.
Yes, and can I ask you, I have what condition did I have? Do you think I should be admitted hospital?
After examination, I think you had an allergy.
Allergies? Yeah. With my drugs.
Your medicine, yeah, your medicine to treat your throat. And I will discuss with my attending physician if whether you need to admit it to a hospital or not.
All right, I got it.
Do you have any question for me?
I just want to know the exact management for my condition because it would be more severe over time, and I'm so scared.
I will discuss with my teacher about your treatment plan, but at first I will give you antihistamine.
Okay, thank you, doctor.
Yeah,
bye.
Great. Thank you, guys. Now let me ask the class friend one quick question. Does any of you know what condition they try to talk about, the two students? Come on, class. Raise your hand if you know what condition they were talking about. This is very important for you as a doctor. Okay, so you have no idea what it is. Yes or no? This is so important, guys. This is so important. I mean, you won't get a medical license if you don't know what it is. This is so important. Come on, some of you should know this. Okay, if you don't know, look at on the note. Yes, Dr. Hall already gave you the answer. I just realized that. Oh my God, he's too nice. Okay, tell me. Okay, tell me what it is.
I think the Wing is having some problem with his drug, like he is allergic to the drug used to treat his sore throat.
Mm-hmm. Okay. And then what happened?
And then the doctors want to know more about his allergy history to make a diagnosis for him.
Okay. So how would you advise the patient?
I think for the patients with allergy with drugs, the patient should be notice more about what drugs cause the allergy, and then every time he had some problem, he should go to see some doctors and make them know that they are allergic to those kind of drugs.
Okay.
It is helpful for him.
So there's a gene defect called HLA-B5801. I don't know if you know this, but this has happened a lot in Asian. And people that take allopurinol, they may have a drug reaction that's called Stevens-Johnson syndrome. A lot of times, this could be a lethal condition. People may die from this condition if you don't follow carefully, because the first couple of days, the rash is mild. Okay, and you think that's okay. You follow a patient and you lost follow-up in the next couple of days, the rash is like entire body. The patient become dehydration, multi-organ failure, and they must be admitted to the hospital. Okay, just learn more about Google that later. It's called HLA-B5801. It's one of the genetic defects. Okay, so
can I?
Go ahead and
it's important. This case is like emergency case. It's important that don't ignore the patient. Patient know themselves better than you. If they say something important, don't ignore them and follow their lead. And if you're not sure, don't think you're the doctor, you know everything. If you're not sure, you will have to ask for a second opinion, or you ask for advice. Don't flush it away and the patient will die. So this is vitally important for a doctor. Don't ignore the patient. And secondly, if you're not sure, you don't know, no one knows everything. If you don't know, you have to ask for help.
All right, thank you, Unfu. Okay, next, any other comment before we move to the next case? Come on, move faster, guys. And I see some of your classmates about sleepy. If you are sleepy, I will pick you. Just be aware, okay? Okay, go ahead.
Hello, Miss. Take a seat. First, I have your name.
My name is Ngọc.
Yes. Hello, Miss Yang. Nice to meet you.
Nice to meet you.
My name is Chi. I am a fifth-year medical student in Untitled University of Medicine, Diagnosis. Yes. What's Dr. Two? Yes. What's brought you here today?
I have many doctors on my face, doctor.
Yes, I see.
Yes. It's annoying me so much.
Yes. How long your hospital is existing?
Yeah, it's happens a week ago.
Just a week.
Yes.
Okay. When it start at the first, how does it look? How does it look?
At first, it's some dust still on my forehead, and then it's reached to my face. And my skin is pressed. Have many freckles on the dusty area.
Yes, and is it the same with the grass and this time?
Yes.
Okay. Yes. And what do you do when and the grass happen? You expose to some chemical or you eat some food?
No, I don't think so.
Yes. Your symptom happened before. This year symptom happened before.
It's happened many times when I was teenager until now.
Yes.
Yes, it's worsening when I have my parents.
On your peers. Yes, I see. Yes, and did you any treatment for this?
I use benzoyl peroxide, but it doesn't help.
Benzoyl peroxide, yes. And this doesn't work.
Yes.
Okay. And are there any other symptoms?
I don't think so. It's just annoying my appearance precisely.
Yes. What about your family history? Are there any people in your family have the same similar symptom like you?
My brother had similar symptom like me when he's vaccination.
Okay. Yes. When your symptoms come worsening, you take benzoyl peroxide. It doesn't work. And did you have any treatment, any other treatment? Yes. And after your period, it relief.
Yes, it's relief.
Yes. And no other symptoms. Okay. Yes. And do you allergic to other certain factors, such as cat or flower or plant?
Yeah, actually, I have allergy with chicken. When I eat it, I feel rough, I feel itchy. I feel itchy, and my face still worsening.
Yes. Okay. I want to take a summary. And if I just want any information, yeah, please correct me. Yes. You will come to the hospital because your blood on your face. Yes, and it's become worsening worse in your ears. Yes, and it's for a long time from when you are a teenager. Yes, and it happened a period of time. Yes, and you use benzoyl peroxide, but it didn't work. Yes, that's all. Okay, thank you.
Thank you, doctor.
Good job, guys. Okay, keep close to roll now, and then I'll give you feedback both. Okay, so why don't you switch now?
Thank you.
My name is Long. I'm a fifth year medical student with Dr. Win. Could I have your information, please?
Yes, my name is Yu. I am 50. I am 50 years.
Okay. So, Mr. Yu, what can I help you today?
Yes, I come to the hospital because some wax on my elbow, on my knee, and on my back. Yes, it's so itchy. I can't stand, so I go to the hospital.
How long do you have it?
It's about 1 year ago.
1 year ago.
Yes, but it's not continuous. It's not continuous. It happens sometimes. It wasn't in a week or a month, and after that it will release and happen like circulation.
Okay. So could I ask you how your grass change over the time?
Yes. What do you
do you notice that when it first started,
yes.
it just last on your elbow or somewhere?
Yes, when this happened the first time, it was located in my elbow, my knee, and my back. Yes.
So it happened suddenly or gradually?
I don't remember. I didn't remember exactly, but I think that it is gradual. Yes, and it lasts about 1 week or 2 weeks. After that, it will be for 2 weeks or a month. It will be worse.
Yeah. So do you know that there are any triggers for your symptoms?
Let me say, I remember that it becomes worse after getting stress. I get some trouble in my life, or after I do trials, it will become worse.
So, what do you do to relieve your symptoms?
I used to go to the other hospital, and I don't remember the diagnosis of the doctor. But I remember that I use spring to apply on my right, and as that's it and steroid, and after that it will release.
It really immediately.
No, it's an hour or a day.
Yes. So, 1 year ago and before 1 year ago, do you have any similar symptoms?
No, I find them. I didn't have any other symptoms like this.
Do you have any associated with your symptoms?
Yes, I feel itchy and painful.
Itchy and painful?
Yes.
Okay. So, what could I ask about your family? Does anyone in your family have the similar symptoms like you?
Yes, and remember that my family is quite healthy and nobody have similar symptoms like me. But my younger brother is allergic to flowers.
Yeah.
Yes.
So, do you allergic to something else like your brother?
Yes, I hate cats because after exposing to the cat, I feel itchy.
Yes.
Yes, and sometimes diarrhea.
Okay. So, beside the cream, the previous hospital give you, do you use any medication?
Yes, I use patient. I trust your screen to apply on my skin, on my scratch.
Okay. I think that's all I need to for my diagnosis. Thank you for your help.
Yes, thank you, doctor.
Very good. I like it. Very good. I like it. Keep eye contact and keep follow the lead. So what the diagnosis for both of you? Okay. So you know her diagnosis? You know what's her diagnosis?
Yes, I think young disease is menstrual acne. Yes.
Okay, you can say acne. You don't have to say menstrual. It's okay. You know when so that you say people don't have menstrual cycle, don't have acne. Just say acne is okay. Okay, and then remember we have an OB/GYN doctor here, so make him really laughing. So. Okay, Ngang, do you know what his diagnosis?
I think after medical history, psoriasis. Okay.
Oh, so group 5 or 6 of you have psoriasis today. Okay, and you're all going to become psoriasis expert. Okay, but it's common. I like this. This is one of the presentations I like you to follow because they are focused on the chief complaint and they go around that. I like it, and they keep eye contact. One thing I like both of you do is try to speak louder. I don't know whatever reason, maybe the microphone doesn't work or I cannot hear you guys clearly. But when you come to the table, speak out, energy. Like you never know how many people have hearing loss outside. So assume if you say too loud, they will tell you. But when you speak loud, this is the best way that you can improve pronunciation. For example, I see many of you could not say rash. So this is something that you have to speak loud in order to pronounce it correctly. So if you keep quiet and speak softly, remember many people, they have hearing problem. They could not even understand what you say. All right, and I know we're reaching the end of the class, but I like to make you awake and don't try to go, don't become an anesthesiologist like Dr. Din used to be. He keep people on sleep, but that's the patient, okay, not the student. Okay, so let's move on to the last group, and I like to invite the group leader. I think Dr. T and Van, and then so Dr. T and Dr. Van, you guys ready? Let's rock. Again, speak loud. It's almost finished, okay? So yelling at each other, I don't care. Make a big arguments. All right, thank you.
So hello, my name is Lee. I'm your doctor. So nice to meet you.
Yes.
So can I have your name, please?
My name is
So how old are you, ma'am?
I am 50 years old.
50 years old. So what is your job?
I am a teacher.
Yeah, you are a teacher. So what problem that brought you to the hospital?
I am biting by the neck.
Okay, you are biting
5 hours ago.
5 hours ago. So what did you do in this situation?
No.
You didn't do anything.
I go to the hospital.
You go to the hospital right away.
Yes.
But it takes you 5 hours. I also go to the hospital.
The first I feel normal, so I can't do anything. But 2 hours ago, my leg is well shiny and bleeding, and some bacteria appear on the legs. So I go to the hospital.
So besides, do you feel any other associated symptoms? Do you have fever or?
I don't have fever, but I have shortness of breath.
So did you know what kind of snake is this?
I see ring snake.
A ring snake.
Yes.
So tell me a little bit about your skin lesion. So is it localized one part of your leg, or now it's moved to widespread to other location?
The snake bite my leg, but
is it the right leg or the left?
right leg.
Okay, in the right leg.
But I have some bruise my arms.
You have some bruise in your arms.
Yes.
So do you have any treatment in the hospitals before at home? Like
no, I don't have any treatment.
You don't take any medications?
No.
Okay. So are you allergic to any medication or anything?
No, I don't have allergy.
Okay. So tell me a little bit about your family. That in your family, does anyone have a problem with some food or some breast or something like that?
The member of family is very healthy.
Very healthy. Okay, very healthy. So so I'm going to summarize your information. So if you notice any wrong information, please you tell me. So you are 50 years old. Your job is a teacher. You are beaten by like 5 hours, and you didn't do anything until 2 hours later. You feel swelling in your right leg, and you feel really painful, and you feel dyspnea. So and you came to the hospital, right? So in your condition, I might think about maybe you really have a big problem because you have the dyspnea, you feel really difficult breathing, and you have bruise in your hand. That means I think that maybe the poison from the snake go into your bloodstream and go to the arm. So I think that I need to do some further tests, like I need to test your blood count. And very important thing for you now to that you need to put you shouldn't move your leg, because if you move your legs, you can make the poison go into your body quicker. And I think that I need to give you some medications now to help you to reduce the pain, okay, because you're swelling and painful.
Doctor, do I need to do use to to detox their snack?
I think that because I look at your situation, I think it's not too severity in order to use the antitoxin for your in your situation. I need some further tests about the blood test, and then some need to check some other problem, like I need to look at X-ray or something that you have any other problem, and then I might consider about using the antitoxin for you. Yeah.
Can I use oxygen?
Yeah, actually, I think the immediately thing now is to give you oxygen. And if you notice any problem about like you pass urine, if you think you see that any change in the color of your urine, you see that the amount of water of urine that you decrease in compared to the normal daily activity. So would you tell me some more about it, please? Yeah, any problem? Okay.
Excellent. Thank you very much. I like the way that you focus on and actually I have no idea what type of snake she will get bit, but it sounds like that's a kind of interesting case. Okay, let's reverse the role. Okay, now you become a patient. He is the doctor. Go ahead. Wow, I like it. Keep going.
Hi, my name is Long. I am a general practitioner. Nice to meet you.
Nice to meet you, doctor.
Yes. Can you tell me what's your name?
So my name is Tate.
Okay. Hi, Mr. T. How old are you?
I'm 60 years old.
How do you feel today?
I feel a little painful in my chest because I have some vesicle and some crust in my right chest. Yeah, and crust. Okay.
And, are there any other symptoms?
Because it's like it's have some associated symptom. Because it's like it has some vesicles, so I feel really itchy, and then I scratch a lot. So now I feel there's some pustule inside, some pustule. Actually, I feel a little bit hotter, but I didn't use the thermometer to measure my temperature, so I couldn't tell you about this.
Are there any similar problem?
Actually, it's the first time I have this disease. But when I was a child, I got chickenpox. It spread on my body with a lot of vesicle and crust like this, but all of my body. Yeah.
Can you ask about past medical history?
About myself, or you want to ask about my family? Myself, I have an allergy to some seafood. And I think, whenever I contact to, to some like the polluted environment, like sometimes I go outside to the to press some, like see them dirty environment, I cannot feel like it's good.
And are there any disease before?
So I'm 60 years old now. So I having hypertension and diabetes for 10 years, doctor. Actually, the doctor asked me to take medication every day, but I'm old enough, so sometimes I forget to take the medication, doctor.
What about families?
Oh, my family. My father died when I'm 60 years old, But in my family, because I'm 60 years old, so my father. Okay. So in my family, my wife still very healthy. I have 2 children, and they don't have any allergens to anything. They are very healthy. Okay.
That's all. Now I will summarize about your information.
Okay.
Your name is T. You are 60 years old. You have a vesicle and rust in your chest. Besides, you have itch, rust, and sometimes you feel hotter, but you don't take temperature.
Okay.
This is the first time you have this problem. You are allergic to seafood and dirty environment. You have hypertension and diabetes. You use some medication every day, but sometimes you forget it.
Yeah.
And you have 2 children, but they don't have any allergy.
Okay, right. But you forget something that I mentioned about like the history that I have the chickenpox when I was a child.
Oh.
Yeah, is it important? Like I think because some people will say that it's more likely for me to get the disease. Yeah. Yeah. Is it enough, doctor?
Yes.
But so I have some question for you, doctor, because I'm really worried. Because like the people who mentioned that when I have chickenpox in when I was a child, now I get this kind of the education in in Yang people call this yeah. So I'm really scary about it. So can you tell me, is it like dangerous? I can die or something like that?
However, you feel for typo,
Yeah.
you should use medication and you use the rim for skin, for your skin.
Yeah, and doctor, can you give me some medication that help me to relieve the itch? Because I will feel really itchy whenever I scratch it. You know, it's red more larger. It's red larger.
So I am a general practitioner, so I can move the dermatologist.
Dermatology. So I
yes.
need to. Okay.
Why don't we actually let me ask Dr. Zhang Fu from Team A his comments. And then, Dr. Zhang Fu, please come on from here and tell us what you think about the two patient and doctor.
Okay, here I am.
Yes.
Yes. I have some remarks for Dr. Vang and Dr. Thi. I think their performance is very good because they have, especially Dr. Thi, that he has strong pronunciation and he has some great ideas. And I feel kind of understand for Dr. Vang to deal with Dr. Thi. And but I have something to make their performance become better. For Dr. Vang's situation, I think Dr. Thi should ask more about the kind of snake. You know, it is very common for the patients in Vietnam to be bitten by red-tailed snake. And yeah, I think we should notice about the characteristic of the snake in order to have the specific antivenom for that patient. And for Dr. Thi's situation, I think Dr. Vang should ask more about the history of the chest pain and like the onset, the duration of the vesicles or pustule on the chest. And I think that's all. That's all I can say about their performance.
Good job, good job. I like the way that you give feedback as a sandwich and you give what they did well and what are the room for improve and summarize. I like it. All right. What else from the class? And let me, so that's everyone from the class today, right? Okay, so let me give my general feedback first and then I'll let other instructor. I'm very proud of you guys. Some of you here very, very good. I am impressed, especially the last one. I can feel his energy. You see, if you talk to your patient with an energetic level, like Dr. T last time, everyone will like you. At least you put your compassion, you put your energy, and you like to know what the problems. So that's the number one thing. Avoid or try not to write down while you're talking to your patient, because that's very distracting. So try not to. I know you try to remember things, but you will get to that point. Now, the case that I'm looking for is actually the acne ones, and I'd like you to take home point from this one. Acne is very treatable, especially for you guys as students. So what are the two key things that you like to tell patients with acne? The number one is they have to use moisturizer. And number two, they have to keep your skin well hydrated. They have to drink a lot of water. And then beside that, they have to use sunscreen when they go outside. Vietnam is a tropical country. So a lot of time it's moist. It's a lot of things that people hate to put a moisturizer in. But in fact, you try to do at night. You don't have to do at like mid-noon. But try to keep your skin healthy. That's one of the first things that you try to avoid or prevent acne. And secondly, you should know that benzoyl peroxide or clindamycin is the most common one, but retinol A is a topical medication that you can use But the most common mistake that most medical students or residents, when they start giving retinol A, is what? They don't give gradual dose. You have to use one time at night, every 2 nights, and then every night, and then you increase the dose. If you give them 3 times a day, the first night, they apply it, and then, so the first day 3 times a day, the second day 3 times a day, the third day, they will not come back to see you. You know why? Because their face is burning and they hate you. So the retinol A's, you have to make sure that they follow your instruction. You have to give small dose, slowly go up. And I know that some of you already use benzoyl peroxide, clindamycin. And then lastly, retinol A, the oral form, it's called Accutane. You have to make sure that your patient is not pregnant. This is illegal, it's required. The patient must be on 2 pregnancy methods. And one of them usually birth control, the other one condom. But they have to have 2 things before you can proceed with oral retinol or Accutane. So that's the 2 common things that I like to share with you as a medical student, so you can become familiar with acne. And yes, absolutely they need to sign consent about that. The other case that I found that interesting, that some of you here become expert in psoriasis. I'm impressed that it's not, it's okay. It's quite common in terms of prevalence disease, but it's compared with other like atopic dermatitis or contact dermatitis, the prevalence is lower. So common things are commons, okay? So for Asians, the psoriasis prevalence is a little bit lower. Caucasian has the highest one. But it's okay. Some of you are very compassionate about that, and I would love to continue the conversation later, because treatment for psoriasis, it's awesome. You know, we move with the Celgene is the last FDA approval. It's a JAK kinase inhibitor. I'm not sure you remember that. That's a very awesome medication. All right, and the other 2 cases you talk about zoster or shingles. This is very common. One, you ask about triggers. Some of you ask about history, but you forget one thing is important. A lot of time when they get older, their immune system are a little bit weaker. So a common cough, something that can trigger like a gastro and acute viral infection from the GI can make or can trigger that. So as you can focus about that. Some of you just focus about history of chicken pox. It's nice, but in real life, many patients may not remember. So just ask them recently what trigger or what happened. Should have a common cold. And smoking. Smoking again, a lot of Vietnamese smoke. Every time when you try to see a patient, even though there's a skin problem or whatever problems, try to talk to them about smoking cessation, okay? Vietnamese men smoke like a chimney. So your job as a future doctor, that's something you can do. And as I say, you guys did really good today. I'm impressed compared to, we've been doing this for many years, but I'm sure this is from Dr. Ho and Dr. Din, because they trained you too well for the past 2 weeks. So I'm looking forward to see you more. And also Dr. Hong Long. I mean, many of you here has been give our student a really big hand. I can see a big improvement. I'm not sure Dr. Din Nguyen, you remember, or Dr. Phu, remember one of our first class at Saigon Medic Cafe and where we are today. That's a big improvement. All right, I let my microphone back to Dr. Hong Lang Chi. Can you say something? I haven't heard anything from you yet.
Hi class. This is very impressive about what you're doing. And like I said, try to speak slower and clearer and pronunciation. Like I said, every sound should be practiced. You don't try to speak so fast because nobody can hear you. So you pronounce every sound. And I have been trying to put a post on Facebook. The medical terminology, the pronunciation that I just recently follow I went to a medical terminology training, so I'm gonna post on Facebook for you, and to see that because this is the training for the American, so they don't use like international pronunciation. Do you hear me? And the class, I can see the pronunciation is very improved a lot, but some of you still like an allergy or allergic. You don't want to stress on the right the letter. So try to, like I said, try to practice every day and pronounce every sound. Pronounce it every day and try to do like 10 words every day regularly. Like I have been study with VOA, Voice of America, every day, 30 minutes, and say loud, and you're gonna see the difference.
Thank you, Jilong. Thank you for insight comments. Make sure you speak slow and clear and loud. Okay, Dr. Fu.
It's always, like last class, it's always end with a high note. And Dr. T, it's always been quite fun. My wife is making a cake. I'm sorry. Let me 5 minutes. I'll finish. They're making cake for me, but not for students. If you come to Australia, you will be regular guest at our house. She loves making cake. All the học mãi students come here. We fed them. They all gain weight before they go back to Vietnam. Now, go back to the talk today. It's always end. We end with a very high notes. Dr. T is always highly entertained. He speaks very clear, very loud, and and confident, but not overconfident. But sometimes when we getting too excited, he revert back to a lot of Vietnamese accent. I can notice that in his style, emphasize the last letter of the word is so strongly, and he need to look back. This one, I just make a couple of jokes on the comment that he on Thuốc Lắc, but sorry, just ignore that. Just making fun. It sound like he's on anyway. So he's good in a way, but when he talks to Dr. Vang, he try to help her too much and getting big, overstep his role as a patient. But in overall, today class doing quite well. I'm not as nice as Dr. Vang, Ji Loan. I'm a bit straight shooter. I want you guys getting better. So but you're doing we see improving. I have provide feedback on your Facebook, but some of them, 3 of you had posted too late. And I'm sorry, we could not have time to provide feedback to you. I know everyone busy, you have to go to university, you do work, I work extra hour, a lot of things. A lot of other things. So I need you to, post it early so we can have time to look at. But I also take our feedback as a constructive, not an offense. Today, Tuấn is still having problem with, he's confident. You need to overcome it. And secondly is, who's his part, or the other one, I forgot what's the name. She's still speaking too soft. Let me see who's it. Tuyền still speaking too softly. You need to speak, a bit more confident way and clearer. So I barely can hear what you're saying. And few other one is doing very well, especially I think other couple, which one, Thiên Nhân and Minh Chi doing very well, Khôi Nguyên doing good. And in other words, got to be a bit more confident, a bit more saying clearly, and Again, I have posted the template that I think last few couples had followed it in template. And this is, I can see the difference when you're taking history. You follow the lead, follow this, good, quite good. And finally, you know, I need to emphasize again, you don't leave the positive, you know, finding. Don't let go. You have to follow with the positive, you know, information. And another thing, Dr. would mention, if the patient they are smoking, your job to tell them straight away advise them how to stop smoking. Just now, I heard no one care about it. I know because in Vietnam, you tell them to, you know, tell the man to stop smoking, to tell you pissed off, whatever, you know, they're not happy. But your job, a doctor, you tell them important how you stop smoking. But in grade, you have attended class well. It's the second time. I'm impressed. But again, please keep up with your attendance. We love to teach you. We're not teaching, but we pass on our, you know, our experience, our knowledge to you. With passion. If you talk about your monetary form, you're not able to afford to pay me. But so we, you know, honestly, so we with passion, we try to help. And Dr. Lan Vo is he put too much, you know, effort into it. To try at the end of 10 weeks, I will be very, very proud of you. So I'll see you next week. Okay.
All right, thank you, Anfu. And then anything, and then let's and then anything before we close the class.
Okay, class. Today I'm very happy with your performance. Anyway, yeah? At the beginning you very, very slow and struggle with how to speak, but after that everything's like speed up, so it's good. And you did well with your introduction. Even that some people still forget to introduce themselves. But anyway, you do very good. And you follow the old card. But something, I always have to say something, but that you just listing the old card, but you didn't focus the leading of the course and that, okay? So this one is take time to do, but anyway, it's a good start, but however, you still have to working on that. Two things that I would like you to work more. First one, that about you use too much about academic terms. You have to translate it. You have to convert it to the language of a little bit layman. So after this class, I will watch the video again, the records again, and I will pick it out which term that you usually use is not correct in the daily activities. Even that Dr. Ho, Anfu, and Win already put it in the chat. But anyway, we have to pick it up again and remind you about that because you always forget that again. Okay. And the second one, that you jump right away off the diagnosis. It's not good at it. That's not good at all. Okay. You should think like different diagnosis, even with a very clear and some clear symptom and very clear diagnosis. But you have to put it number one is something, number two is something, and number three is something like that. Okay. Never think just one thing in the diagnosis. It's not good at all for your mind. Okay. Thank you.
All right. Thank you, class. And I am glad to see you formally today. But I hope you can come to my round on Thursday and also Wednesday for medical basic speaking. And I'd like you to continue that. Whatever you learn from today, try to bring to the medical speaking class or at night. Practice your skill and keep practice. Come to Wednesday night, come to Thursday night to see me, okay? And you'll be amazing. A couple of weeks from today, you speak medical English like a pro, okay? All right, see you guys.
Okay, next slide. Okay, just a moment. Next week, Dr. Fu will go back again. So try to make sure that you do the homework before you go to the class next time. Okay, thank you.